So one of the treatments and susceptibilities for patients is going to be discussed next. So susceptibility, it's a pretty complex thing with Streptococcus pneumonia because many different clinical symptoms can come up that are very prevalent in other diseases. Like before in the earlier video, it was discussed that there are several different diseases that is caused by this one strain of bacteria. Otis media, sinitis, septic arthritis, osteomyelitis, peritonitis, endocarditis, a whole host of upper respiratory problems, including pneumonia. When trying to figure out if it's pneumonia or different other problems, or that Streptococcus pneumonia might be associated with the disease that is going on, there are specific age groups and susceptibility levels. So, high-risk age groups, those are children younger than 5 years, particularly 2 years and older. This is why we do like a full vaccination in the beginning of somebody's life, is because we can then kind of cut these things off from the butt. In adults older than 55 to 65 years old. Conditions that cause immune deficits, HIV infections, malignancy, diabetes, mellitus, and other immunodeficient diseases that can really make us susceptible to this bacteria. And other conditions too as well: asthma, chronic bronchitis, which we'll discuss later, chronic obstructive pulmonary disease, which can be brought on by bronchitis or by other diseases, and even seasonal, so presentation from late fall to early spring. Also, it's pretty known that smoking can also help cause pneumonia or other different types of upper and lower respiratory diseases, just because smoking has carcinogens in it, but not only just carcinogens, it's got tar, it's got toxics, you're inhaling smoke, you're destroying your lungs, it's destroying the cilia in the lungs, it's making us susceptible to more diseases, it lowers your immune system, and all around it just destroys your bodies in many different ways. And there are other conditions that could be direct extensions from the nasopharynx, which is like conjunctivitis, otis medium, sinitis, stuff of that nature, bronchitis, pneumonia. But the Streptococcus pneumonia can also be it can also be a vascular invasion, which that would then mean it's in the bloodstream, and that's through meningitis. Joint and bone infections, it can cause soft tissue infections like cellulitis, abscesses. That's how people obtain abscesses in the brain, or they obtain abscesses in other areas. It could be that, not just Streptococcus pneumonia, but it can be that, cardiac infections and such of that nature. That's why there's a whole host of things. To diagnose it, a doctor would have to order gram stains, culture appropriations from several different things: pleural fluid from the lung, joint fluid, bone, abscess, the cerebral spine fluid, blood, just basically the things that you would think of to get those types of things. And there's also imaging that can help. If a doctor if the doctor thinks that it's pneumonia, there could be chest radiology, there could be an ultrasonography of the chest. They could see a CT of the chest, the sinuses, the face, etc., an MRI of the brain in case if it's meningitis or infected the bones. Other things that can help, just like, there's many other different things: lumbar puncture, joint fluid aspiration, biopsy of the bone, etc., etc. So there's different ways to kind of figure out what Streptococcus pneumoniae is actually causing. One of the ways of management is most of the time, well, actually almost every time, is through antibiotics. I'm going to be specific with just pneumonia because that was the kind of thing that I wanted to talk about. With pneumonia, for penicillin sensitive Streptococcus pneumonia, you want to use penicillin G or amoxicillin. It's considered the first line therapy, and it's considered pretty powerful to attack the bacterium. If it's not penicillin susceptible, then there's a choice of antimicrobial agents that will be detected by testing the susceptibility of the bacteria to different variables. And so that's what the doctor would order. There's also other treatments that can help manage things. For complicated pneumonia, there's chest tube placement for drainage of pleural fluid. You can actually remove some of the lining of the lung in order to get rid of the either scarring or the problems that make it so you can't expand the lungs to be able to breathe. And other things that can help manage it, for prevention, is again behavior modification in terms of learning how to wash your hands, keeping your hands and face away from each other, risk factor reduction, immunization. For the high susceptibility populations, people that have been smoking, people that are exposed to certain chemical agents, again, age factors and all sorts of things can go into trying to get an immunization.